Your brain needs support, and new Ollie Brainy Chews are a delightful way to take care of your cognitive health. Made with scientifically backed ingredients like Thai ginger, L-theanine, and caffeine, Brainy Chews support healthy brain function and help you find your focus, stay chill, or get energized. Be kind to your mind and get these nootropic chews at ollie.com. That's OLLY.com. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
This episode is brought to you by Bumble. So, you want to find someone you're compatible with, specifically someone who's ready for a serious connection, totally open to having kids in the future, is a tall, rock-climbing Libra, and loves rom-coms with vegan pizzas on Tuesdays just as much as you do. Bumble knows that you know exactly what's right for you. So whatever it is you're looking for, Bumble's features can help you find it. Date now on Bumble.
The Dental Download podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Okay, hi everyone. We have another guest here today, fellow D4 student Lauren. I've been literally meaning to get her on the podcast since we were starting dental school. So it's 3.5 years late. But here we are, and it's exciting because we finally have even more things to talk about. But Lauren, do you mind just introducing yourself? Tell us a little bit about where you're at.
Hi guys, I'm Lauren Elmblad. I'm a D4 student at UNE. I am from Michigan's Upper Peninsula, so we have something in common, Haley. We're both from Michigan. But yes, I go to dental school in Maine.
So yeah, we kind of connected from mutual people that we knew. And then Lauren also has a dental Instagram page where she shares what she's up to during dental school. So it's been really fun kind of mutually keeping up with each other over the years and kind of comparing curriculums and just generally seeing each other's journey through school has been really fun. Can you talk a little bit about what you're involved in over at UNE, any different organizations or any different externships? What do you do, I guess, outside of the things that are assigned for you to do?
Yeah. So I feel like I'm very active in ASDA. I feel like we met up at ASDA in Chicago once, Haley. That was fun. What else? I'm involved in, it's called interprofessional education. So at our UNE campus, there's PA students, occupational therapy, physical therapy, and the list goes on. So we do a lot of simulations together and just talk about working together when we get out of school as professionals. So I do a lot with that. I'm also a UNE CDM ambassador, so I take people on tours, help with special events, stuff like that. I was very involved in the pediatric dental club when I thought I was going to be a pediatric dentist. No longer in that, but I did a lot of work with that. I like to volunteer. Yeah, I feel like right now I'm just kind of enjoying a lot of Maine before I leave.
Yeah, that's the nice part about fourth year is you get to scale back a little bit from all the hectic, busy schedule and all the extracurriculars. You can just kind of enjoy your friends and the place you're living for the last little bit before you kind of move on to the next stage.
Exactly.
So before we talk about how you ended up on general dentistry from peds and kind of what your future plans are, I want to backtrack a little bit and just talk about your pre-dental time and deciding to go to UNE. So what was that process like?
I feel like that was so long ago. It's crazy because it really wasn't. I was actually just reading a couple of notes that I wrote down when I was a dental assistant in college saying I put the patient's bib on for the first time and I was able to seat the patient and I was so excited. And I'm almost a dentist now. It's so crazy. So I did a lot of dental assisting in college. I went to Northern Michigan University for 4 years. I studied microbiology and health and nutrition there. I graduated in 2020, so I didn't officially get a graduation. I don't think you did either, Haley, did you? Yeah, we got that taken from us. I did that. I applied to maybe 10 schools for dental school. I only applied one time. I took the DAT one time. And then I ultimately got interviews at Detroit Mercy and University of New England. And this was the only school I applied to out east. I actually came here on vacation and I really enjoyed Maine. I'm going to apply to school out here. So I did. And then I was torn between Detroit and here. And I waited until the very last second to make my decision. And honestly, I'm so happy that I chose to come out here because it's been a great experience and it's been fun living in New England. And yeah, so that was really tough for me, but Yeah, it was great. I'm so glad I did it.
Okay, we've been talking to a soon-to-be graduated dentist, but let's mention an old friend from SimLab, ADEC. You might not know this, but ADEC equipment is in 85% of dental schools in North America, mine being one of them. So there's a good chance you spent some really long hours in SimLab using this obviously reliable equipment. As pre-dentists who are passionate about detail, we can relate to the reason ADEC manufactures the majority of components that go into their equipment, and then scientifically tests it for minimum 20-year life. If you're considering your own practice, check out the link in my show notes for resources, complimentary professional services, and Smart Start, a program for first-time practice owners offering up to 25% discounts on ADEC equipment for your first 2 years. Thank you to ADEC for working with me on this episode. I mean, everyone, whatever they see us post on social media, like you have to take it with a grain of salt. Like it is mostly like a highlight reel and everything.
Mm-hmm.
But from my perspective, what I see you sharing about all your clinical experiences and like the early exposure that you got to doing fillings, prophies, things like that, or the amount of peds that you've gotten to do, or the amount of endo. You just placed an implant this week. It's like
I know.
all these really cool things that most of those things we don't do at my school, or we barely do. So comparatively, I'm like, wow, that is an awesome school. And I feel like it's kind of a hidden gem, or at least nationally, I don't hear people talking about it as much.
Right.
So what are some of your like maybe couple favorite things about the curriculum at UNE, or some cool experiences that you've gotten to have?
Yeah, I do honestly feel like it is kind of a hidden gem. I mean, some schools now, everyone kind of markets their school as, oh, we have early clinical experience and whatnot. And as a pre-dental student, I didn't really understand how important that was. But I'm glad I chose to come here because we have no specialty programs at our school. So there's no like perio residents or oral surgery residents or endo residents trying to do the hard cases. So we get to do all of them at school, obviously overseeing or being overseen by the faculty here. So like we have all the endodontists, oral surgeons, periodontists, pediatric dentists, all under one roof with us. And our class sizes are really small. So we're able to get that one-on-one kind of feedback from our faculty. So yeah, this week was like super exciting. So it's funny that I'm on here. So what day was it? Wednesday, I believe. Yeah, yesterday, maybe Tuesday, I don't know. I placed an implant on number 28. It was so fun. And the oral surgeon was right there with me, basically holding my hand while I did it. But it was so cool. So I got to do that. And if there was like an oral surgery or perio resident there, they would have obviously gotten that case. So that would probably be my number one favorite thing about UNE is that there's not very much competition when doing the hard cases. I get to do like molar root canals. I see pediatric patients all the time because my classmates don't want to see them. So they give them to me. So I see ages like 3 all the way up to 88 years old. So, and we don't do certain rotations at school where like I'm in peds for a week or I'm in OS for a week. It's just like all the time. If your patient needs an extraction, you do it. Or if they need a root canal, you do it. So I like that aspect of UNE. I also like how tight-knit the community is. Like it's a very homey feel there. I don't really feel like it's very cutthroat compared to other schools. I mean, obviously there's the classic gunners and you hear all that funny stuff because we're all such type A people. But yeah, we're a pass-fail school. So D1 and D2 year, that was really nice, like not competing with everyone in that sense. And then I also feel like I just really like the location of UNE. It's really fun. You're about 2 hours from Boston. Portland's really cool, right on the water. Vermont's nearby. There's lots of fun skiing and fun things to do. So that's UNE in a nutshell, I feel like.
Yeah, that's a lot of good information for people to consider, and things that you don't really understand as a pre-dental, like why would pass fail be kind of nice, and why is it helpful to not have specialty programs when you want to be a general dentist. But I'm curious, I know now that you're going to be a general dentist, you have your job and everything figured out.
Yeah.
But when you were thinking about pediatrics, how did that look when you knew you were at UNE? The fact that you didn't have a specialty program there and you weren't going to be like ranked by academics. Did you think that was going to affect you when applying to residencies?
Yeah, so I have actually a friend who just applied to a pediatric residency, and all of us are very confused about that when we get here. We're like, wait, so if we're not ranked, how do we match up with everyone else in the country at the other dental schools? So actually, you are secretly ranked at UNE. The dean does have a list of who's the number one in the class, etc., but no one sees it. until you apply to residency. So you obviously still have to try really hard in school, get great grades. You strive for what's called letters of commendation. That just says that you excelled in the class and you had to get like a certain percentage on everything. I don't remember what it was, but you had to accumulate some of those, and then you get a dean's letter. There's like a whole process of how to do it, but there's quite a few people who have matched into specifically peds from our school, but also perio, endo. I have a friend who just got into ortho at BU, so that was exciting for her. So yeah, there is a way to show that you really stood out, but mainly same thing as pre-dental, like volunteer experience, extracurriculars, all that good stuff, getting a good grade and everything. So you still have to try really hard. And there is a secret ranking list. I feel like you don't know that going in until like your third year.
Yeah. It's kind of nice that it
ranked.
doesn't affect you though, because if you don't want to know, you don't have to know.
Right, exactly.
And I have some classmates, we are graded almost every class. Some classes are pass fail, which is kind of ridiculous because let's say we have like 28 credits and then 3 are pass fail, and you work really hard to pass the class, then you don't even get like credits towards your GPA for passing it because it's not a credited class, even though it counted as like some of those 30 credits that you had to take. So basically you're doing all this work and then not getting any credit towards your GPA for it. So I would rather just have everything graded at that point.
Yeah, might as well. One or the other.
Yeah, not that grades like specifically matter for me that much, but just as a concept, it's weird that it's not all graded or all pass fail. But I have some classmates that are like, everything's pass fail if you make it that way. Like in your head, if you're okay getting a C+ because you passed, then power to you.
But it's hard to be like that when you see that grade.
Yeah.
So that is one nice thing about UNE. Like it took that edge off, I will say. Because like it wouldn't pop up as a grade really. It would just say pass or fail. And then you can retake, obviously, but
yeah,
it was nice. So
that's nice too, because all of our boards are like that too.
Yeah.
So if that's how they're licensing us and like giving us standards of accreditation and things, you would think the schools would all kind of adopt the same philosophy.
I think they will eventually. I feel like everyone will, hopefully.
Because it seems to work. It seems to work well, and like your school and ASDO and just other schools off the top of my head of students I've talked to that are pass fail. It seems like the students are really excelling and seem to know a ton, like have great clinical knowledge and be really proficient. So it's kind of like, man, like maybe that's the way to do it. So
yeah, because I feel like we're not cramming, like we're cramming still for some classes, but I feel like we're genuinely wanting to know it. And if we don't get the perfect score, at least we try and know what we didn't know, because we didn't know the grade. So we don't know what we got wrong. So we review everything, if that makes sense. So we'll be like, oh, we'll still go over the exam with our professors and whatever. So
how big is your class size?
So my class size is a little bit small. So all the ones before me were 64. I'm down to 61. We lost a couple, sadly. But they just increased the class size to 72, I believe.
Okay. So it's smaller, but it's not the smallest of all the schools that I've heard of.
Yeah.
I think smaller, generally speaking, is better. I wouldn't want to have like 30 people, but I think 75 to like 120 is like a sweet spot. I feel like the schools that are 200 plus is like too much. We start with 110, and then we have 20 international dentists join our class to get licensed in the US during third year. So they're with us third and fourth year. So we graduate with 130.
Oh, nice. See, we normally get, I think, like 4 to 5 international, but we didn't, our class didn't, because we were the goofy COVID class. So they didn't get it together or something. I don't know.
Yeah, that's interesting.
And I guess I could add a couple other things about UNE and what I did. So I also was a TA at school. So I TA'd in the sim clinic, which was fun for the first and second year students last year. And then also what we have at our school, I don't know what you have, Haley, but we have 10 to 12 week externships in the summer, spring, or fall of our D4 year. So I went out on my fourth year externship in the summer, and I was in Burlington, Vermont area. It was so fun. And I got to treat the migrant farm workers in Vermont on Mondays. And then Tuesday through Thursday, I was in a private practice. So it was really great.
And was that 12 like consecutive weeks that you lived there? Wow. And how did that work for like housing and food? Is that just good luck, figure it out? Or
pretty much. So that is one con, I will say. They're working on that, but I feel like a lot of the offices are just profiting from us. because like we're doing a lot of the work in the hygiene checks and whatnot. So yeah, but I had to pay double rent. So I convinced my twin sister to move out here with me for the summer to split rent with me.
That was smart. Yeah. For
But
us, it's 4 weeks per semester because we have 3 semesters a year. So it's
mhm.
12 total. And then each time, each of the four is a different site. So it's nice you get to experience like different clinics
Oh,
because some of them are, I would say, like really excellent clinically and some are just okay. So if you get stuck with a just okay one, at least it's not your only experience. You still have two more.
yeah,
And
that's good.
because it's a shorter duration, they put us up in a hotel that's funded by the school and they comp like our gas mileage and we can use like basically like a rental car through the school. So all of
Oh,
that's
that's so
great.
nice.
Yeah, you have to do your own food and the hotels they're not like the really nice ones with like a mini kitchen or anything. So you kind of just eat like freezer meals and stuff for a week, but it could be a lot
That's fine.
worse. I think the standard across the health professions for the externships though are that you have to figure out your own housing. I think our school is
Yeah.
really unique in that. Like my friends in medical and PA, when they do their externships, it's like a good luck finding
Mm-hmm.
something kind of situation. There are like different like traveling nurse websites or like places for like
Yeah.
more major locations that you can find like really short-term rentals that I know they've used. So I'm sure there's ways to do it in a way that's not too expensive, but I think you just kind of got to embrace it and
Yeah.
be like, this is a cool experience. I'm checking out a new place. It's all
Yeah.
part of the
It was
education
crazy.
cost.
Yeah, the thing though with us is like part of UNE's mission is serving rural New England. So they send us way up north to Maine, Vermont, New Hampshire. They have a couple sites in Boston, I think, and now a couple in Rhode Island, which is cool for people from there and stuff, but it's pretty rural, so there's not really much housing.
Yeah, I'm sure that's a challenge, but is it like wherever you went, did someone else go there last summer too? So you could at
Yeah,
least like find maybe like where they lived and have that help
yeah.
you?
Yeah, they have like a good spreadsheet of like the housing and like getting in. They try and help us as much as they can, but a lot of us are like, wow, we have to pay double rent and I don't have children, so I didn't get a commutable site because some people can get the commutable site near here. Yeah, it was okay. It was fun.
And I'm also curious, what has your general experience been like moving away from home, like several states away? Like, what advice do you
Mhm.
have for someone that's doing that for dental school?
I would say definitely come visit before. I know they're doing a lot of virtual interviews for dental school now. I would recommend coming to see what you're getting yourself into, see if you really like the area and you would be comfortable like basically living there for 4 years, not just the like you need to think about not just the school, but where you are, because especially being far from family and friends, it's a huge transition. Like I came out here not knowing anybody, and that was kind of freaky, especially during the pandemic. So I would say, yes, definitely come visit, try and connect with someone at the school, like a student there, so you can get a little bit of insight on where to live, stuff like that. And then use FaceTime, call your family and friends, lean on them, even though it is virtual, and try to visit during the breaks. Go home on the breaks. Even if you don't feel like you want to travel back, do it. You'll always be happy that you went to visit home.
And I know you were considering pediatrics and then you ended up deciding on general dentistry. What was that thought process like?
So before dental school, I was an assistant in the general office and a pediatric office. So I did get to see kind of the lifestyle of a pediatric dentist before I got to dental school. And then I started working on adults and I noticed that they would just open their mouth when you asked them, and it was less behavior management and more dentistry. I think looking at just treating adults and children in like a family dentistry aspect fit my personality more than seeing kids all the time. I think I would do fine with being with kids all the time, but I would eventually get burnt out because it's pretty tiring profession. Plus I didn't want to do more school. So I was like, general dentistry will be good for me. I love the idea that I can refer out to all the specialists if things get challenging. I like that I'm not the last resort. So that's kind of where I was at with that.
And how did you know you wanted to go work right away and not do a general dentistry residency?
I think at UNE, they do a really good job preparing us clinically, especially with the long externship sites and just having all the specialists there to, and the general dentist to kind of talk to so much because there's so little of us. that like as third and fourth year students, we're able to really learn the tips and tricks one-on-one every single day here. I feel nervous to go into the real world, but excited, and I feel ready enough to go. So I felt like I didn't need to do a GPR or AAGD. I mean, some people in my school and in my class are going to do that, which is fine, but I feel like I've known I wanted to go into dentistry for so long that I feel like you too, Haley, we've been like slowly preparing for this since I don't even know when. So I feel like we're as ready as we can be to go out in the real world. And I've also been told that you learn more on your first year of working than, and you're getting paid versus
Mm-hmm.
going to an AEGD or GPR and paying in. You'll learn like the same amount, if not more, like going out there. So I'm ripping the Band-Aid off.
Yeah, I think it's just a lot of personality preference, and we're
Yeah,
more the type to just dive in and get going
yeah,
and
exactly.
adjust from there. So what's your job search process been like? I mean, I know initially were you even considering staying out east, or did you really
Yeah.
think Michigan was going to pull you back? What was everything kind of running through your head?
So I feel like starting dental or before dental school in like 2019, when I had to decide between Detroit or here, I feel like I was in that same boat again about, okay, do I go back to Michigan or do I stay here? They're very similar. If any of you have not been here, it's a lot like where I'm from in the Upper Peninsula of Michigan. So, but everything's close and there's like more city, more people, more fun things to do. So that was really intriguing for me. But so yeah, I was thinking about staying in Maine or even Vermont. I got a couple of job offers from my externship sites. They were looking for an associate, and that was really appealing. And then everyone's coming to our school. Oh, we need dentists in Maine, and that was appealing also. But something in me was just pulling me back to the UP because it's such a rural place and there's such a high need for dentists there. I feel like I need to go back at least for a couple of years to just give back to that community that got me to where I am today. Something in me is like, I need to go home and just try it because I know a lot of the specialists there, and I feel like that will be the most conducive for learning for me right out of the gate. So, yes, it was a conflict to move back to Michigan, but I'm happy I'm doing it, at least for now. Who knows? I might be back here someday.
And it sounds like the job opportunities you got out east or through your school, through externships, just really like
Yep.
connections that you made. And is that also the same situation with the job that you ended up going with back near your home? Is it doctors you worked with before back in your like pre-dental days?
So weirdly enough, it's not. A lot of those dentists did not need an associate at the time. So I was kind of like, okay, well, I want to move back, but it seems like no one needs me now all of a sudden. They say they need so many dentists in the UP, but right where I wanted to be in Marquette in the UP, they didn't need a dentist. So I'm like, oh shoot, this isn't working out for me. So I actually reached out to the Patterson dental rep for the UP. The different offices I was working at, I would see him all the time. He would come in to fix different things at the office and be like, oh, hey, Lauren, you're here now. And oh, what's up? So I reached out to him and he connected me with the dentist I'm going to be working with. So weirdly enough, we'd never met before when I was in college there for 4 years. We didn't know each other at all. We knew mutual people, but now we're together and it's like the best thing. I'm like, where have you been? So he's looking to sell his practice eventually too, which is exciting. So
Very
another big
cool.
decision will be coming again, I'm sure.
Are you the first associate that they've had?
I think they have an associate, or they've had an associate there. They have one there 1 day a week. I think she's slowly retiring though. So she's on her way out. But yeah,
Nice. Are you super excited?
I'm excited. I don't know about you, but I'm a little bit nervous. Just like thinking I've been having dreams about it. Being a
Really?
dentist and like no faculty around and they're like, what do we do, Lauren? And I'm like, I don't know.
No, you know more than you think you do.
I
And
know.
we're not going to be like completely alone, which is nice
That's
about
true.
having other doctors in the office or people you can call.
Yeah, because
So
are you in a big group practice?
not big. It's an interesting structure. It sounds like there's a lot of doctors that work there, but day to day, it's really just two of us, including myself, because I'm
Okay.
taking over the owner's schedule. So he'll be available after while I transition, but his
Oh,
goal
I
is to
see.
not be there full time anymore, but there'll still be the other full-time associate seeing patients. Plus, the owner's wife is also a dentist who works part-time there, but basically the owner and the wife both do different to very niche dentistry things is what they
Like
want to focus
what?
on. Sleep apnea TMJ, and then
Oh,
the wife dentist, she does more like pediatric early expansion and tongue tie and things. So very unique
Interesting.
stuff. Yeah. And then me and the other associate will handle all the general dentistry up to slightly more advanced things, endo, implants,
Yeah,
cosmetics,
definitely.
as we feel that we can handle. So I'm
But
excited
that's
to
exciting though.
learn
You can
along
learn a
them.
lot from them in their little
Yeah.
niche. That's really cool. You're
Yeah.
gonna have
I'm
to tell
looking
me
forward
all
to
about
it.
it. Yeah.
Yeah, it should be cool. When do you think you're moving back to Michigan then?
So my lease here is up May 31st. I should ask you this question while we're on here. How long does it take to get our license?
So the website for Lara in Michigan, like the licensing website,
I was just on
says
that. Yeah,
up to like 6 weeks, which is not that long.
that's
But I
not that long.
hear
Yeah.
like through the grapevine, oh, it can take months.
Yeah.
But last year's class, my like roommates that are working now,
Hmm.
they got their license in just a few weeks, like 3 weeks. It was
Whoa.
super quick, but they were ready. They had everything filled out online, everything done in advance that they could, other than the diploma that they had to wait on. So, like, as
See,
soon as
that's what I was
graduation
thinking I was gonna
happened,
do.
they sent everything in. So, they were probably in like the first wave of people to get approved.
Yeah.
I have like a month from graduation until my start date, but there's the understanding that my license still might not be there. So, I'll just be around the office doing whatever in the meantime if I'm
Well,
not
that'll be
fully
nice.
licensed yet. Exactly. So,
But it'll be like mid-June for you or beginning of June?
yeah, June 10th is my start date,
Okay,
technically.
yeah. See, I don't have a start date yet because I didn't know how long it took. So I graduate May 17th. But I was just on that Lara website trying to figure it out. And I'm like, I bet I could get it all filled out ahead of time. And the same thing, wait for your diploma and then send it in, right?
Yeah, I think you can do almost everything. I don't know if you can do the fingerprinting, how far in advance. That's the other like random thing, but
Oh
everything
my
else,
gosh.
all your boards, all your personal information they need to type in, you can get all that
Yeah.
set up in advance. Which,
Okay.
and they even sent us information of how we can like pre-send our diploma starting like next month to the
What?
boards people so that it's quicker later or something. I don't know. They gave us some information about that. I
Oh,
haven't
good to know.
done what it said in the email because it said like starting February something you can do it. So I was like, okay, I'll go back to it next month and see
Yeah.
what that's all
Okay.
about.
That's crazy. Yeah. So probably June I'll start.
Yeah,
Probably move back. Yeah, very end of May, beginning of June, and then I'll start.
that's so
Exciting.
exciting.
Yeah.
So before we kind of wrap up the conversation here, we've gone through pretty much an overview of everything you've gone through over the 4 years
Hmm.
of transitioning to UNE, what your experience has been like, some of your favorite things, and now that you found your associate job,
Hmm.
what kind of overarching or like final thoughts do you want to leave people listening with? It's a lot of dental students and just aspiring dentists listening in.
As for like advice for dental school
Yeah,
or
just
just in
general
general? Okay.
advice.
Words of wisdom. All right.
Yes.
So I would say this applies to when you're in the sim clinic. I guess this even applies as a pre-dental when you're third and fourth year in dental school. Just sticking to yourself, leaning on each other, but sticking to yourself and staying in your own lane, not comparing yourself to others. Just compare yourself to who you were the day before, not anybody else. I feel like that got me really far as a pre-dental student, for a second year, third, and fourth year dental student. And honestly, now during the job search, because everyone's like, oh, do you have a job yet? Do you have a job yet? And we all just want to know what everyone's doing. Just compare yourself to who you are, not anyone else, because that'll drive you crazy. Comparison kills. And also, if you have any questions about UNE and are interested in moving to Maine for dental school, let me know.
Yeah, I'll put your Instagram in the description of the episode, but do you want to just tell them your username so they can look you up too if they'd rather do it that way?
Yep. So it's at tooth.fairy.lore on Instagram. And just message me and I'll get back to you as soon as I can.
Thank you so much, Lauren.
Yeah. Thank you. That was so fun.